Pediatric vaccination plans are underway to protect children ages 5 to 11 against COVID. In Travis County, 75% of eligible residents have received at least one shot, but some parents are still considering whether or not to get their child vaccinated. Here to talk about this is Dr. Lauren Gambill, Assistant Professor of Pediatrics with the Dell Medical School at UT. Thank you for joining us.
Hi, thanks for having me.
You know, what is your message to parents with kids ages 5 to 11 about this vaccine?
I mean, the main primary message that I am sharing is that the vaccine is safe, the vaccine is effective, and this is really the moment that we've all been waiting for.
You know, for parents who are wondering, exactly how dangerous is COVID to a healthy child aged 5 to 11?
So that's kind of a nuanced question. I think there's a lot of reports that the COVID illness in that age group is milder, but we certainly see kids get very sick. We certainly see that children have died in this age group as well. And so it's hard to stratify exactly
talking
what the
about
risk
that, is your message for parents different for healthy kids versus kids with health issues about this child's vaccine?
So I think all children that qualify, that are eligible, should absolutely be vaccinated. If kids have other underlying conditions, they're at more risk personally for severe disease, but healthy kids can get sick too. And even one child hospitalized is too many, one child death is too many. And so every single child that is eligible should absolutely be vaccinated.
For parents with kids who have already had COVID, there are concerns about children who already have natural immunity, then getting this vaccine. What are your thoughts on that?
That's a great question. So I think there are so many unknowns with what the immunity is following an infection. And I don't think we know enough to say that those kids are protected. And so absolutely they should get the vaccine to ensure better protection against future COVID infection, because we know that you can be infected more than once. And we know that as variants rise, you may be more susceptible, even if you've had a previous infection.
Is natural immunity play a role in any of this?
So that's a good question that I don't think we fully know all of the answers to. I think there is some evidence to show that there may be some immunity in some people, but we don't have a reliable way of testing to find out exactly who is going to be immune and who's not. And so I think until that's a possibility, vaccination for all eligible children is really the safest thing for kids.
Now, the CDC is monitoring reports of heart inflammation after receiving the mRNA vaccine, especially in teenage boys, young men. That has caused some parents to remain cautious about getting their younger children vaccinated. And some doctors have said that the sample size in the Pfizer study was too small to know for sure if heart inflammation could be an issue with younger kids with this new vaccine. Should parents be concerned about that?
Yeah, so that's a great question. I'm so glad that you asked, because myocarditis is an adverse event that we have seen extremely rarely in older adolescents and some adults. What we also know, though, is that myocarditis is a known complication of COVID infection. And so, there's risk either way. What we're seeing is that myocarditis, so you're absolutely right. The first thing is that there were no cases of myocarditis in the trials for 5 to 11-year-olds. That being said, because it's such a rare side effect, it's not totally unexpected that we didn't see that complication, because you need to have vaccinated huge numbers of children before you would even see one case of that in theory. But what we do know is in cases that vaccine-induced myocarditis is milder than infection-induced myocarditis.
A final question, doctor. For parents out there with kids in this age group who are hesitant, in fact, a couple days ago, I think Matthew McConaughey said that for now he's out. They look at COVID, they look at the numbers as far as the children who have died and who have gotten sick, and I believe 28 million kids in that age range in this country, 94 of them have died out of 28 million. 560 something have been in the hospital because of this. Then they see a brand new vaccine, quite different from your Dip-Tet and your Rubella that have decades of data. And now they're being told you need to vaccinate your child with this brand new vaccine with a handful of studies, and they're hesitant. What do you say to them?
So first, I think everybody wants the absolute best for their kids. And I think it's normal and expected and the responsible thing to do as a parent to really, really question every single medical decision that we make. And then I try to talk through the evidence. I talk through the fact that the research behind this, that while this vaccine was developed quickly, the research that supported the development has been ongoing for years, decades. And so the data is not new. This has been monitored in the closest vaccine safety monitoring system in US history. And I think, I know we have every reason to believe that this vaccine is safe. Extensive risk benefit calculations and studies have been conducted. And, that number is small, thankfully, as a pediatrician and as a parent. I'm so thankful that kids are not disproportionately impacted by COVID-19. But if that 94th child was my own or my patient, I just can't help but put myself in that place. And it's absolutely, the benefits far outweigh the risks, in my opinion.
All righty. We are out of time. Dr. Lauren Gambill at UT, thank you very much for talking with us.
Thank you so much for having me.